Our next panel, The Lifestyle Prescription, Delaying and Preventing ADRD Through Behavior Change, will talk about the importance of reducing the risk of dementia and Alzheimer's and how to get people to take action. We'll explore the science behind risk reduction and lifestyle changes people can make to promote their own brain health. Here's our moderator, Marc Middleton, founder and CEO of Growing Bolder.
Good afternoon and welcome to this live session that's dedicated to helping everyone celebrate the blessing of growing older, to maximize the opportunities of an entirely new life stage, and to look at aging through a lens of purpose and possibility instead of simply loss and limitation. And of course, the most important key to all of that is lifestyle, the daily choices that we all make. We've heard from Ken Dykewald and others at this summit that Alzheimer's disease is a public health crisis that just continues to grow, with nearly 14 million people expected to be diagnosed by 2050. And women and communities of color do bear a disproportionate burden, with women now making up 2/3 of all Alzheimer's cases. And by 2030, nearly 40% of all Americans living with Alzheimer's will be Black or Latino. And while there is not yet a cure, we do know with scientific certainty that cognitive decline is not inevitable. Working together as patients, as families, as physicians, and as policymakers, we can begin taking some aggressive steps to not just reverse the current trend, but ultimately to stop this dreaded disease. And folks, I got to tell you, this is not just Pollyanna-ish wishful thinking. The latest research, which we're going to share today, is that if we reduce the prevalence of 10 specific risk factors by just 15% each decade, as many as 1.2 million fewer people will be living with Alzheimer's and related dementias by 2050. These people are you and me. They're our families. And by the way, if we had hit that number in 2020, nearly 500,000 fewer families would be living with dementia today. So what are these modifiable risk factors? You guys know them well. We'll talk about them today, but these are things like diabetes, obesity, high blood pressure, physical inactivity, poor diet, poor sleep, tobacco use, and excessive alcohol use. These are things that we can control through lifestyle change. And if we can do that, we can maintain our cognitive capacity. We can keep our brain healthy. We can increase our lifespan, but more importantly than that, our health span as well. Today, we're going to hear from some of the world's top experts about these lifestyle changes. We're going to hear what's possible. We're going to learn what challenges we need to overcome and how we can all make progress together. And we hope to have time to answer some of your questions as well. So allow me to introduce each member of our esteemed panel and ask them to make an opening statement. First up is Dr. Karen Hacker, the director of the CDC National Center for Chronic Disease Prevention and Health Promotion. Dr. Hacker oversees more than 1,000 staff, all dedicated to preventing chronic diseases and promoting health across the lifespan. And among other important duties, she leads agency efforts to address the social determinants of health. Dr. Hacker, take it away.
Thanks so much. And I'm really honored to be here today with this audience and to be working on this shared goal of helping millions of Americans understand and manage and reduce the risk of Alzheimer's disease and related dementias. I want to highlight the work of CDC's Alzheimer's disease program and the work of all of our partners, many of whom are here today. Our funded partners are focusing their work to shore up the public health infrastructure for Alzheimer's disease and other dementias through the National Healthy Brain Initiative and the BOLD Infrastructure for Alzheimer's Act, which includes the BOLD Public Health Programs and the BOLD Public Health Centers of Excellence. Alzheimer's disease and related dementia, as you have already heard, are a growing systemic threat. And based on what we know, what keeps the brain healthy turns out to be pretty similar to what keeps the heart and the rest of the body healthy. Emerging evidence is now suggesting that small changes like lifestyle modification and managing chronic diseases like diabetes and obesity can really help with brain health. So CDC's data is suggesting that correspondence between several modifiable risk factors may actually have an influence on the risk of cognitive decline. So with your help and the help of our funded partners, we can reduce the risk, we can increase early detection and diagnosis, we can support caregivers and help reduce unnecessary hospitalizations. We're committed at CDC to using a public health approach to promote risk reduction for cognitive decline and Alzheimer's disease and related dementias. And this includes supporting interventions that reduce the barriers by addressing the social determinants of health. These are the factors that are outside of health systems that actually contribute dramatically to our health outcomes. And we're really committed to doing this, particularly in communities that are bearing the greatest burden. So we view our social determinants of health work as a pathway to addressing the problem of health disparities. And the goal is to achieve health equity in our work and reduce the risk factors for ADRD through behavioral change.
Thank you, Dr. Hacker. Folks, this is not rocket scientist, but we do have a scientist with us today. On our panel is Dr. Roch Nianogo. He's the assistant professor, Department of Epidemiology, Fielding School of Public Health, University of California, Los Angeles. And Dr. Nianogo's work investigates the impact of lifestyle, metabolic, and social interventions in preventing chronic diseases, the ones we're talking about: obesity, diabetes, Alzheimer's disease, and other dementias, and then translating that evidence into effective clinical, public health, and policy interventions. In his recent work, he investigated the importance of modifiable risk factors for Alzheimer's disease and other dementias. Dr. Nianogo, your opening statement, sir.
Thank you very much, Mark, and thank you everyone for having me here. I'm very honored to be here. So we know today that engaging in a healthy lifestyle, like Karen was saying, such as eating healthy, exercising, and maintaining a healthy weight is really important for preventing chronic disease such as heart disease and type 2 diabetes. What was less known, or at least what has been known within the last decade or so, is how these risk factors actually relate to Alzheimer's disease and other dementias. And this is what my research lab at UCLA, as well as other colleagues, have been able to focus within the last, within some time ago. And there are three main things that I wanted to highlight. Like, the first thing is what is good for the heart is also good for the brain. We found that within our studies, for example, maintaining a healthy weight was actually one of the most important things you can do to actually reduce your risk of Alzheimer's disease and other dementia. Second, the prevalence of actually a lot of risk factors have actually changed over time. One example is midlife obesity, which has the prevalence has actually doubled, more than doubled actually within the last decade. It was about 13%, and now it's about 26 and 36%, in 2018, which means it's very important to tackle. Thirdly, the relative difference in the proportion of Alzheimer's disease that are related to some of these risk factors actually differ by different subgroups defined by race and ethnicity. For example, midlife obesity was really important for Blacks as well as whites. And it was also physical inactivity was important for Asian Americans, for example. So this actually gives us an opportunity to tailor and target intervention within different subpopulations. So I think within the next couple of minutes, we'll talk about some of these things in detail.
Thank you, Dr. Nianogo. And rounding out our panel today is Susan Benigas. She's the executive director of the American College of Lifestyle Medicine, which now has nearly 9,000 members. Ms. Benigas leads a staff of 40, overseeing the effort to transform health and actually to redefine healthcare, and not just here in the U.S., but around the world through her work with the Lifestyle Medicine Global Alliance. She is also an author and a much in-demand international speaker. Ms. Benigas, take it away.
Thank you, Mark. It's such a pleasure to be here today, and sincere thanks to Us Against Alzheimer's for the tremendous work they're doing and shining a bright light on this. Truly, it's a pandemic that we face of Alzheimer's. And Mark, in your opening comments, you talked about the upward trajectory. You know, we already have 6.5 million people, 65 plus, who've already been diagnosed with the disease in the United States. And when we look at the economic toll, you were talking about statistics and trends that if we stay on the current trajectory, by 2040, 2050, we will spend in direct costs alone over $1 trillion in treating Alzheimer's. Yet, the best news that any of us could hear, and based on the work of some of our members and leading researchers in this field, Dean and Aisha Shirzai, Dr. Dean Ornish, is that as much as 90% of Alzheimer's is preventable. And in the balance of that 10%, much of that is to be able to dramatically delay the onset. And it's as much about adding years to life, but truly adding life to years, ensuring that those lives are vibrant and cognitively healthy. And so the leading preventer is lifestyle intervention. It's evidence-based therapeutic lifestyle intervention to prevent Alzheimer's, knowing that 90%, as much as 90% is preventable. That is great news, but it means that we must take decisive action. And so, as you said, I serve as executive director of the American College of Lifestyle Medicine. It's a role I've had for nearly 9 years. ACLM is the nation's medical professional association that represents physicians and also allied health professionals who are dedicated to treating root causes of disease, to focus on prevention, as well as for many of the chronic conditions, heart disease, type 2 diabetes. Evidence strongly shows that therapeutic lifestyle intervention can prevent and often even reverse these conditions. Where Alzheimer's is concerned, it's much more about the prevention of it, of course. And so our first and foremost priority is to fill the gaping void of lifestyle medicine in medical education. So that's where we invest heavily, and we're on a mission to do that because we need all of our physicians and medical professionals who have unfortunately not had the benefit of being trained in therapeutic lifestyle intervention as part of their traditional medical education by and large. So we are addressing that across the entire education continuum, from undergraduate medical education to graduate medical education, all the way through to continuing medical education. As the need is so urgent, we must reach those already practicing so they know and understand the evidence to use lifestyle, what people are eating, how they're moving, how they're sleeping, how they're thinking, to be able to prevent disease, to protect their health, and to even fight disease.
You know, given what's at stake for us individually, for us as families, and for us, Susan, as you point out, as an entire culture, I don't know if there's a more important conversation that we all can be having than the one we're having right now. So let's get with it. Let me pose the first question to Dr. Hacker. You know, obviously, we all know that behavior change is hard, but we also know that our symptoms and even our culture and some of our communities don't always support us in making those healthy choices. So, Dr. Hacker, can you share with us the interconnectivity between the known risk factors for dementia, some of the ones we've already mentioned, and what's often referred to, in fact, it's been mentioned a couple of times already, the social determinants that impact our health? What's that interconnection about?
Sure, and you're helping me out a lot there, Mark, because I think first and foremost, we need to talk about the fact that dementia care and support services really vary pretty widely, depending on your race, your ethnicity, where you live, and your social and economic factors. But then there's also stigma and cultural differences and awareness and just understanding what Alzheimer's disease is. And all of these can be factors that lead to health disparities. We also know that there's a lot of disparities and a lot of inequities in even how people get a diagnosis or manage their disease, and even their ability to get high quality care. So about 95% of older adults with Alzheimer's disease also have multiple chronic conditions. And with that, those conditions, we know that some of those are driven by these social determinants, right? So if you need to exercise and you don't have any access to places that are safe and available to exercise, or you don't have access to healthy food, so how can you possibly have a diet that won't contribute to these diet-related diseases? And we do know that Black and Latino patients are at greater risk for ADRD than their white counterparts. And some of that is because of these social determinants. And as I said, literally where you live. So as we really begin to learn more about those contributors, then the question becomes, how do we start to ameliorate them? How do we get communities mobilized to start seriously considering what they can do about these? How do we start to increase social connectedness, particularly for elderly patients, and really begin to make sure that the healthiest opportunities are opportunities that everyone can take advantage of? Now, that is not the simplest thing in the world, and we really do need collaboration on multiple levels to really get that work done.
Susan, trite but true, zip code more important than genetic code now to our overall health.
Well, yes, and we have Dr. Jason Purnell, who has been with St. Louis University, to thank for really being the first to shine that light on the zip code does influence greatly one's health outcome. And yet we really champion the fact that, yeah, there are social determinants of health. These are influencers, but everyone can be educated, equipped, and empowered with the adequate support to overcome. And so this is true. And when we know, it boils down to something very, very simple. This is simple. And it can be, as in a recent conversation I was having with Doctors Dean and Aisha Shirzai, that if one simply consumes 2 servings of greens a day, on average, that will add as 10 to 12 years of vital cognitive health to their life. Taking a brisk walk, 20 to 30 minutes a day can reduce the risk of Alzheimer's by 40%. Now, there are these issues that are real that we are all working very hard to address. Some of them are, unsafe streets and food deserts. And I was at the lake recently, didn't have a grocery store nearby. There was a dollar store near. This was down in southern Missouri. And I went in and I was able to buy frozen vegetables and canned beans. This was something, this wasn't expensive. And so there are ways to address this and to empower people. And but we have to be very cognizant of the challenges that many face. But it can be as simple as running in place, doing exercise with your, in front of your television screen, and frozen vegetables, while, fresh and organic may be optimal, that is not attainable for everyone. So there are alternatives and ways to take steps in a positive direction. And but we do need to educate, equip, and empower people. And we need to realize that we do have a glaring lack of food, health, and lifestyle literacy in this country that we definitely need to address collectively.
And Dr. Nianogo, I think we all owe you a great gratitude of thanks, because your research has not just been fascinating, it has been illuminating, it's been validating, it's proving what I think all of us have been saying for a while, but now we can back it up with your research. You have proven that there's a modifiable list of risk factors for Alzheimer's disease and other dementias, things that we can change that will reduce our risk, but ones that are most prominent, most damaging, and therefore probably most important to change, have actually changed themselves over the past decade. Why is that, and what are the most important risk factors for us to be aware of today?
Thanks, Mark. And just following up on what the great speakers have also said, I also want to highlight that this research has been conducted with the help and inspiration of Dr. Deborah Barnes from UCSF, and who has actually led the study as well. But we did conduct a study about 10 years ago, and actually Dr. Deborah Barnes actually conducted a study about 10 years ago, trying to investigate and find which modifiable risk factors were associated with Alzheimer's disease, things like midlife obesity, midlife hypertension, type 2 diabetes, smoking, depression, hearing loss. And we found actually that some of these risk factors today actually have changed. About 10 years ago, it used to be smoking, depression, and physical inactivity that were actually the major risk factors that were associated with Alzheimer's disease and dementia. Today, as Mark mentioned, midlife obesity is the most important thing that we have to really think about when it comes to type 2 Alzheimer's disease risk and dementia, followed by physical inactivity and low educational attainment. But as Mark said, actually, the prevalence of some of these risk factors actually have changed over time. As I mentioned in the beginning, about 10 years ago, the prevalence of obesity was about 13%, and it actually more than doubled now it's about 36%. And that means it actually has propelled midlife obesity to be one of the most important things that we have to think about when it comes to the prevention of Alzheimer's disease and dementia. Smoking, on the other hand, has declined a little bit from about 20% to now about 18%, which is good news, but it's still high. We need to keep doing, promoting smoking cessation programs as well, and encouraging people to maintain a healthy lifestyle, like maintaining a healthy weight.
And I think that underscores, the scope of the challenge that we all face. Susan, the fact that obesity, which is maybe the most recognized, identified, accepted risk factor of all, and has been known for decades, is worse now than it was before. And one reason for this, from my perspective, and with all due respect, is that many in your profession, certainly not you or your organization, are still prescribing medication before lifestyle modification. What's missing in our current medical education system, and how is that changing? Is it changing?
It is changing, Mark. And yes, and to Roch's point, there have been so many things lately that have really been emphasizing this. I mean, even the Institute of Health Metrics and Evaluation, the largest repository of health-related data in the world, in its 2019 Global Burden of Disease report, found that when looking at data from almost 200 countries, it's what people are and are not eating that's the leading cause of disease and death. And certainly it's what we are and are not eating and our lack of physical activity, and that are the leading drivers of obesity, to your point, Roch. And so all of these things are inextricably connected. It's not as though these chronic conditions are siloed. They're all connected. And yes, medical education is beginning to change, because there is this recognition that for far too long, we have really had an allopathic only approach to diagnose symptoms and to treat those symptoms with ever increasing quantities of pills and procedures, which is unsustainable. It's about disease management as opposed to health restoration and real prevention. And so, as I said, this is really, ACLM is championing the effort to fill the void of lifestyle medicine and medical education. And we have people like Congressman Jim McGovern and Congressman Burgess out of Texas, who recently pushed through a House resolution to advocate for nutrition to be incorporated into all medical education. And then we just participated, ACLM just participated last week. There was a monumental, historic White House conference on hunger, nutrition, and health. One had not taken place for 52 years. And ACLM made a huge commitment in support of that conference. And this was highlighted in a fact sheet that the White House issued last Wednesday. And our commitment was just one of a couple of dozen, and it was a $24.1 million commitment, 22 million of which was to offer 100,000 complimentary registrations for our 5.5-hour CME accredited lifestyle medicine and food as medicine essentials course. And so anyone even watching today who's a medical professional who would like to take advantage of that complimentary registration can go to lifestylemedicine.org/WH conference and take advantage of that, because we know that we have got to ignite a seismic shift in healthcare. We really have to, we want to be the catalyst that ignites this type of transformation that moves us from a system of just disease management to one that really is prevention focused, and even for many conditions to be able to treat those root causes in an effort to identify and eradicate the root cause with the goal of health restoration. And conventional medicine, we're grateful for it. All of the medical professionals that ACLM represents are conventional medicine docs. They prescribe medication. They just don't, as you say, Mark, they don't lead with it. They lead with a lifestyle medicine first approach. And this is what we are advocating, that lifestyle medicine become the foundation of all of health and all healthcare. We see these shifts happening, and even the White House conference last week is part of that shift that we are seeing and that we will all ultimately benefit from.
Speaking of healthcare champions, speaking of the White House, let me come back to Dr. Hacker. She's the champion. She hangs out at the White House. In fact, recently, the Biden administration, in part due to your support, Dr. Hacker, and your engagement, amended our nation's national plan to end Alzheimer's and added a new plank to that plan that's called Promote Healthy Aging, Reduce the Risk Factors for Dementia. What can you tell us about Goal 6 in the national plan to address Alzheimer's disease, and how is it now being used to actually address Alzheimer's disease at your organization, the CDC?
So this was a super exciting event, as you can imagine, for us in 2021, when they updated the national plan to address Alzheimer's disease, and they added that Goal 6, which emphasizes risk reduction. And those are much of what we're talking about right now. We led the development. We're excited to roll out our activities in support of the achievement. And in addition to this goal, it's aligned with our mission at the National Center for Chronic Disease Prevention and Health Promotion, which is really about promoting health and wellness for all. This new goal builds on the CDC's National Healthy Brain Initiative, and that focuses on promoting dementias, including African American, Hispanic, American Indian, and Alaska Native populations, and those who have intellectual and developmental disabilities. And through the initiative, we actually fund several organizations, including Us Against Alzheimer's, to address needs of the population at highest risks, in addition to developing culturally relevant materials. We also fund the Building Our Largest Dementia Infrastructure, or the BOLD for Alzheimer's Act. And that awards help to accelerate and elevate risk reduction at local, state, and national levels. And that includes BOLD Public Health Center and of Excellence on Dementia Risk Reduction, which in turn supports states, locals, and tribal public health agencies and help them identify and translate and disseminate all of this material. So basically, we work through a lot of our colleagues and a lot of our awardees to be able to get those messages out. The Center of Excellence, by the way, is going to hold its first national meeting on dementia risk reduction at CDC in May of 2023. And we're going to showcase the latest science related to the intersection of risk reduction and social determinants of health. We're also supporting a thematic network on risk reduction through 3 of the prevention research centers. And one of the strategies of Goal 6 is to address the inequities and risk factors for ADRD. And as I mentioned earlier, our work at the center focuses on addressing these social determinants of health that can lead to health inequalities. So along with Biden's executive order on advancing racial equity and support for underserved communities through the federal government, CDC is just one of the many federal partners working to meet the tenets of the national plan and reduce ADRD disparities among racial and ethnic minorities. There's a lot of evidence-based interventions that can promote healthy aging. They're often related to the risk factors we've been talking about. And that could make a substantial impact in promoting the health and well-being and independence of older adults. So a lot going on in this space. It was really just an incredible fire below our feet to be able to get this new addition to the national strategy. And again, we're working with all of our partners to make it a reality.
It is exciting. It's a major pivot from waiting on, hoping for the miracle cure, something that's going to cure it for us. And now the responsibility, folks, is coming right back onto our own shoulders. And Dr. Hacker mentioned health and well-being for all. She mentioned the social inequities, which is a great segue back to you, Dr. Nianogo. To be as effective as possible, this messaging has got to be slightly different for different communities because we all hear things differently. We all react to messaging differently. Your research has helped substantiate the fact that the modifiable risk factors for Alzheimer's disease and other dementias does vary. These factors do vary according to race and ethnicity. How so?
Yeah, thanks again. And then thanks again, Susan, for all your work in advocating again for a lot of research towards understanding the social determinants of health, especially as it relates to Alzheimer's disease and other dementia. The one thing that also it's important to also note is the opportunities that we have, especially as Marc was mentioning, the fact that different modifiable risk factors are important at a different level for different race and ethnic subpopulations. For example, midlife obesity, that is obesity in the midlife actually, was actually very important and one of the major risk factors for Black, whites, as well as American Indian and Alaska Natives. And I was mentioning in the beginning for Asian Americans, it was physical inactivity. For Hispanic population, it was low educational attainment. That was one of the most important things that we needed to tackle. And these actually are very important because, as Marc's mentioned, that means we can actually tailor and target and intervention for different subpopulations to be able to reduce the overall risks for that subpopulation and hopefully reduce the risk of Alzheimer's disease and really dementia overall. We think actually the differences that we actually observe right now is actually due to the relative difference in prevalence for different subpopulation. So for example, when we look at American Indian and Alaska Native, the proportion of smoking, for example, was about 3 to 4 times higher than that of Asians, and which actually translated into basically the proportion of excess Alzheimer's disease cases that we expect to see. So for example, if we take about 100 cases of Alzheimer's disease cases and other dementia, about 11 of them would be expected to be attributed to smoking for Alaska Native and American Indian, whereas about only 3 of them would be expected to be related to smoking for Asian Americans. So that actually gives us an opportunity to be able to target what is really most important for different subpopulations. And so I think there's hope there to be able to reduce disparities, tailor interventions through lifestyle changes, and hopefully reduce the overall burden of Alzheimer's disease and dementia risk.
So, Roch, where do we begin? I mean, your research has nailed it. I mean, you've proven that these risk factors are modifiable. You've proven that we have to have different messaging for different communities. But but what's step one? What do we do? What actually can we begin to make a difference in our own lives?
Yeah, I'll start where I began. What is good for the heart is also good for the brain. So basically, as we've known for some time now, and as some of these, the study that we conducted, as well as other large randomized control trial, like the FINGER study, has been able to show pretty convincingly that engaging in a healthy lifestyle, such as exercising, eating healthy, and maintaining a healthy weight, was actually really, really important in actually reducing one's risk of Alzheimer's disease and other dementia. In our study in particular, maintaining a healthy weight was actually one of the most important things that one could do to prevent or reduce the risk of Alzheimer's disease dementia. And the other thing that I think is important also to note is it's really critical to focus on things like modifiable lifestyle risk factors because those are mostly readily accessible to most people. Relative to pharmaceuticals, for example, if we think about it. And also, as we mentioned in the beginning, there's no effective cure for Alzheimer's disease. And being able, lifestyle changes, for example, is able to empower patients and individuals to be able to be proactive within their lifetime and act early whenever and if possible when they can.
Let me throw one out for the entire group because I think Dr. Hacker mentioned that the administration's new goal and federal activities. What's the role of the private sector now? Is there an opportunity for employers? Is there an opportunity for technology platforms? Is there an opportunity for the wellness industry to get involved? I mean, how do we get the private sector to support what everybody else is saying that needs to be done? I'll just throw it out there.
Well, I'll hop in first with that. And Marc, this is, and I know that we would all agree, we face a crisis. I mean, we've just weathered and are still weathering the pandemic of COVID. We have a pandemic, a looming global pandemic that we're already living in of lifestyle-related chronic disease, with Alzheimer's being one of that. And Roch, as you just said, what's good for the heart is good for the brain, and is good for preventing type 2 diabetes and treating. And so these things are all inextricably connected. And we as a society, and this is what Karen so champions, is that we need to come together on this. And the private sector has a huge role to play, because even when you look at healthcare costs in this country, a huge part of that healthcare cost burden is on the shoulders of our self-funded employer populations. And for them, there is immense profit in health, not only for the well-being of their employees, for reining in their employee healthcare costs, but from a productivity and every other standpoint. And I think that there has been a lot of confusion around this. As I said before, I think that there is and evidence shows there's a really glaring lack of food, nutrition, lifestyle literacy in this country across the board. And so it is going to take major communications. It's really this intersection, as I keep referring to the Shirzais because they're so deeply entrenched in this and an important part of Us Against Alzheimer's and the Brain Health Academy. They really advocate for the intersection of technology, community, and media. And I could not agree more that we need to leverage these intersections and find out, just really collectively come together and figure out how to optimize those, because it is about communicating to everyone that they are not a victim of their genes by and large, that we can, through the power of our lifestyle choices, even though many of us face obstacles, that we can be empowered to take far greater control of our health destinies by what we eat each and every day, how we move, how we sleep, how we think and manage our stress. And that is an empowering message for everyone. And it means that we can reverse this trajectory that is truly unsustainable.
And Dr. Go ahead. Go ahead.
I wanted to follow up on what Susan was just saying. I think it's really important, and thanks again for making that great point, that a lot of the lifestyle factors, now I think with a lot of research, we realize that all of these risk factors are common to a lot of chronic disease. Again, like heart disease, type 2 diabetes, Alzheimer's disease, cancer. So the good news there is that we can actually focus and target lifestyle factors and be able to prevent many chronic disease at the same time. So I think this is really empowering, but also I think it's important for patients to be able to know that there's something that they can do, and also something that they can do early. And I think making that message clear and simple and accessible to most people, and actually shifting the focus and the emphasis from pharmaceuticals to lifestyles, for example, could be really empowering and actually be able to help in the prevention of a lot of chronic disease, which is very disabling, and as well as it costs a lot to the healthcare system. And I think focusing on lifestyle factors, for example, is very, very important. And I think one thing that I wanted to mention as well is within the private sector, even like different schools, universities, workplaces, promoting healthy lifestyles, for example, like, walking within the office or outside the office, for example, are things that are simple, or even like having healthy diets, for example, at the cafeteria, are things that we can do to be able to change the culture within the institution.
Great point. Well stated. Dr. Hacker, I am not going to ask you to take on the lobbyists, the pharmaceutical industry, the fast food industry. You're welcome. But let's talk about the elephant in the room. There is a lot of money spent on major marketing messages that do not align with what we're talking about today. How big of an obstacle is this to the messaging that we're all trying to get out there?
It's a little bit like Samson and Goliath, right? I think that's the right comparison. Basically, we're dealing with a real challenge here because the resources that communities have, for example, to address some of these areas, if you look at some of these communities with food deserts, for example, they are fast food oases, if you know what I mean. So somehow they have a lot of options for unhealthy situations and not a lot of options for health. I think that some of that happens over time, and people will always argue, we want to give consumers what they want, right? So a lot of this is, I think, about how do we change what consumers want. To me, the fact that Alzheimer's is now evidenced and related to these risk styles is one more step in the process, right? So we knew that diabetes and heart disease and hypertension were related to these social lifestyle kinds of things. But now we know Alzheimer's is too. The challenge, I think, is both in the prevention elements, like how do we, it'll be fascinating to see what some of the Nutrition Summit recommendations are going to actually do. I don't know if you all saw recently, but the one about what does a healthy cereal actually look like? And I was a little surprised. I don't know about you, but when I saw the grams of added sugar in some of those cereals that I always took for granted to be healthy cereals, I got to tell you, it made me open my eyes, and this is my area of expertise, right? So I think some of this is going to be influenced by consumer knowledge, but I also have to say that, once an individual is quite obese, it is very challenging to change that simply by exercise and diet alone. And so I do think we have to match what we're doing in the lifestyle challenges with appropriate medical interventions. And to me, there's got to be a hand in glove kind of experience there. I am a little concerned that now, as we're starting to talk more and more about obesity medications and things like that people will simply turn to those as a response, which in some ways is much easier than trying to make these lifestyle changes. But I think what you've heard from all the speakers today is we've got to make those lifestyle changes for sustainability, for the future, really, of our population. So there's a lot to do, but again, we cannot do this alone, and we do need industry and we do need business to get on board and to help us, because it's not doing them any favors in the long run.
We are quickly running out of time. I want to get a quick takeaway from everybody. But before we get that, an audience member has asked that all speakers are emphasizing the importance of good eating habits, but there's not been recognition, at least during this conversation, about different dietary preferences. It seems that healthy diet takes an approach of one size fits all, and obviously that's not the case. Does anybody want to talk about dietary preferences and a healthy diet for different ethnicities?
Well, I'll just weigh in here. I mean, I think we've done, certainly at CDC, a lot of work in making sure that the types of recommendations are culturally appropriate. But there are still some things that all of us can agree to, which is too much salt, too much sugar, and too much fat. And regardless of what your preferences are, those are pretty much consistent across the range. And I think that when you're working in this area, it is absolutely important to work with communities to understand what those preferences are, to understand how, and to really get the advice from them about how they think they can begin to influence change.
And just to follow on that, to say that actually we can actually agree on the main things that we could do: sugar, fat, as well as salt, but also like we can think about as ultra processed foods that basically do not require any cooking. They're ready-made foods and have been highly processed, have a lot of adjuvant in there and ingredients, and those are the ones that we need to avoid at all costs if we can. So just wanted to add to what Susan was saying. Go ahead, Karen.
Perfect
I would
addition.
agree. And Mark, and just to add to Karen and Roch's comments, it's always about keeping it simple. And as the Institute of Health Metrics and Evaluation, 2019 Global Burden of Disease report showed, it's about what people are and are not eating. And so to Karen and Roch's point, we're consuming an abundance of the packaged processed foods, too much added sugar and salt. And so what should we be eating? What has evidence shown to be those foods that are most protective of health and most fighting of disease? And it really boils down to something very simple. It's that which grows from the ground and as close to nature's package as possible. And it's whole food, plant predominant eating patterns. And because it's those foods that are plant-based, that are fiber-filled, nutrient dense, antioxidant rich, and those are the foods that that evidence shows will really help us to protect our health and, again, fight disease.
I don't know if we could have more motivation than we do as a culture, folks. I think every survey that's been taken about the greatest fears of middle age and older adults reveals that cognitive decline is either at or near the top of the list. In fact, we fear Alzheimer's more than cancer. In most cases, we fear it more than death itself. So we do have the inspiration to change, the proof that we can delay, that we can diminish and even prevent the onset of Alzheimer's disease and related dementia. So guys, I'm going to act like a TV producer here and see how good you guys are at giving us a 60-second takeaway. What do we need to do? How do we activate the inspiration? Let me start with you, Dr. Hacker.
Well, I guess I would just say that prevention actually does work. We've kind of known that for a long time. And now the real challenge is, how do we embed it in our everyday lives in a way that's easily done by everyone, with accessibility for everyone, and I think the educational perspective on that in terms of, even things like reading food labels can get easier. And again, I'm going to harken back to the summit last week because there were a lot of great recommendations, and I definitely advise folks to take a look at them.
Dr. Nianogo, give us your takeaway, sir.
There is something each and every one of us can do to reduce the risk of Alzheimer's disease and related dementias. The main one is maintaining a healthy weight through, for example, engaging in physical activity and eating a healthy diet. We can all do something to be able to empower ourselves, to be able to engage in some of these lifestyle modifications, to be able to prevent not just our risk of Alzheimer's disease, but also our risk of heart disease and type 2 diabetes.
Susan Benigas, the floor is yours.
Thank you, Mark. Well, I would say in my capacity representing the nation's medical professional association that probably more than any other is championing lifestyle medicine and food as medicine. It's a call to all of our medical professionals across this country to become trained and ideally even certified in the field of lifestyle medicine so that it is embedded into all healthcare in this country as a first treatment approach. So, because for every physician that we reach, he or she typically has a patient panel of 2,000 patients on average. So even the commitment that we made to last week's White House conference of the 100,000 complimentary registrations for the Lifestyle Medicine and Food as Medicine Essentials bundle, that alone, if we reach 100,000 physicians and they each have 2,000 patients, we will have planted seeds of change in 2/3 of our population. And so that's a call. And just for patients to know that we all can begin to take steps each and every day. It's never too early to start, and it's never too late to start to really prevent Alzheimer's or, worst case, delay the onset. And so it's an empowering message that I think we've all brought forth today.
What an honor for me to hang out with you big brains and talk about keeping all of our brains healthy. My thanks to Dr. Karen Hacker, Dr. Roch Nianogo, and Susan Benigas for the work that you guys do every day on our behalf. You guys are on the front lines of one of the most important health battles in the history of humankind. And your message today is extraordinarily clear, folks. We can't just wait for that elusive cure. We have the power to save ourselves. That power resides in the lifestyle choices that each of us make every single day. So I ask you this: who is your primary care provider? You are. Thanks for joining us, and be sure to share this information with your family. Have a great day.